An exciting session where we hope to give you a deeper understanding of the ECTV process and what's involved. But what we really would like to see is that at the end of it, some or most of you feel comfortable to take on the challenge of becoming an ECT visitor yourselves. And what we would love is to engage supervisors doing ECTVs on other people's registrars so that we could get a greater breadth of information back from what people are seeing, but also giving the opportunity for supervisors to go into another practice, see what's happening there and see how things are being done differently. So that's what we would like to see come out of this session.
It's great to be here. We have spent quite a bit of time collectively putting this session together from a few other sessions that we've done before, and we look forward to your participation and then feedback about how you found the session, and at the end whether there's some other things that you would like to discuss, because we're always developing these sort of things to try and address the needs that you bring. So as Tamsin said, I'm Emma. And with Penny and Chris, we're absolutely delighted to be here. I guess the first thing to clarify really is that we have a number of terms to label what we're calling directly observed teaching visits, and that's probably the most accurate term. We have two colleges involved in training practitioners in general practice and rural and remote medicine in the Northern Territory, and we have slightly different needs from those colleges with respect to what we're observing and what we're assessing. So today, the directly observed teaching visit is being called the external clinical teaching visit, which is the terminology that comes from the Royal Australian College of GPs. And we are also using the MinCEX form, which is the Australian College of Rural and Remote Medicine's form that's used for an ECT visit, external clinical teaching visit. So apologies for all of those different terms. If you can synonymously think of both the ECT visit form and the MinCEX form collectively, regardless of what name we use, we would really appreciate it. Is that fair? So just to outline our objectives for this session for the next hour and a half, we'd really like to help you understand the value of these visits in the general practice setting, to understand the process of conducting such a visit within the auspices of the Northern Territory General Practice Education Program, and as I've said, the two colleges, to understand the principles of giving feedback in a visit. And from my perspective, that's probably the most challenging part of this, and it is really what we're talking about, so that the process and the structure of how you go about performing these is something which is fairly straightforward, but it's how do you bring it together so that it's the most efficient and effective learning experience is really where the challenge is. And to experience giving feedback in a role-played clinical scenario, because we know that if we experience what it's like to give and to receive feedback, it helps us to develop our mode of doing that also. So these are some additional objectives: to understand the collective experience from the audience, to understand the challenges in giving ECT visits, and to describe the supports that Northern Territory General Practice Education offers, the way we can get started.